Angiograms. Angiograms are invasive tests where they come up through the groin or the wrist and they come right to the heart and they flush the artery with dye, and now we can see where the plumbing problem is of the arteries. That's an important test to do if you have unstable artery disease, meaning you're having a heart attack. You don't want to do that test just to see where my risk is of a heart attack or stroke. Why? Inside the artery wall is all skin, just like the skin on our face. And if I go and poke around inside the artery wall and damage the lining of skin, I could do more damage than good than doing an angiogram. So an angiogram should only be done for people that have unstable artery disease. Well, what about a CT angiogram? A CT angiogram is a virtual angiogram where they put you through a tube or a cylindrical tube, and they see what's happening in terms of what the arteries are doing in a virtual way. And it's a good test to do, but it's not as accurate as the cath angiogram when we go inside the artery wall. But it does give us a good look at the bigger arteries. The big arteries are about 300 micrometers. It does tell us if there's a blockage or something that's happening there, but it's hard to look at that. We got to keep your heart rate stable, and it doesn't tell us always the consistency of a plaque just because of the imaging. So it's not always the best test to do just to see where your arteries are in terms of a plumbing problem. Why? The majority of heart attacks and strokes occur with blockages that are less than 50%. So if you don't have a bigger stage of heart disease, then it's okay. We don't need to do a stent or bypass. And you don't want to do stents and bypasses anymore unless it's an emergency. And that's where it's important to understand these tests, and that's what we do at the HeartFit Clinic.